Hi, this is Joseph Manacop, and I am here to show you a video of how to change dry to dry and a wet to dry dressing. And this is my patient right here, my daughter Lexi, and that is her wound. The first thing we're going to do is actually go to the patient's chart. We may have to make sure that there is an order for a dressing change. And we gather up all our equipments and supplies, some 4x4 sterile gauzes, ABD, clean gloves and tape, and a marker, and 0.9% saline solution, sterile saline solution. For this example, we are not going to do an ABD because her leg is pretty small and the ABD is actually pretty big, so I'm just going to pretend that this 4x4 is the ABD. So after we gather up all our supplies, we enter the room and do hand hygiene. We introduce ourselves. Hi, my name is Joe. I'm your nurse for tonight, or today, whichever. And explain the procedure that you're going to do. We're going to change the dressing. Do you have any questions or concerns? Are you allergic to any medications? Make sure the patient is not allergic to anything that we're going to use. We're going to give the patient some privacy, either close the door or close the curtains, put the patient in the position of comfort, raise the head of the bed or lower the head of the bed, and make sure you have a clean and dry table or working area for your supplies. Okay, again, I'm going to do hand hygiene. We're going to ask the patient their 2 identifiers. If they can tell us their name and their date of birth, once that's confirmed, we can go ahead and proceed. After doing hand hygiene, we're going to don some clean gloves to remove the current dressing. Okay, first thing we need to do is kind of slowly peel it, pushing them apart slowly. One thing is to, not sure if I mentioned it already, we can pre-medicate the patient 30 minutes prior to the procedure if the procedure is going to be causing any pain to the patient. Make sure we toilet the patient as well, so there won't be any, the patient will not have to go to the bathroom or anything like that in the middle of the procedure. So we're going to remove the cover or the ABD slowly. Make sure you note any blood or exudate or anything on the gauze covering or the ABD. We're going to dispose of that properly. Now we're going to remove the dry dressing. Actually, let's go change gloves. We're going to do hand hygiene again. We're going to put new gloves in. Okay. Now we're going to remove the dry dressing. Now if it's stuck, we can put another 4x4 and put 0.9 sterile saline solution on it and just gently peel it off. So we're going to take, ooh, it is stuck. I guess we can do that. Alright, you open up a package of sterile 4x4s. Make sure it's intact. Also open up a saline solution, make sure it's not expired. Pour it. You kind of moisten the other gauze. So it'll easily come off. All right, there's her wound. We're gonna properly dispose of the gauze. You remove your gloves. Do hand hygiene. And we're gonna put another pair of clean gloves. We're going to pick up one 4x4, grab the edges, kind of squeeze up the excess saline there, and then you wipe from top to bottom or proximal to distal. Get rid of that. Do the same thing on the second one. Again, proximal to distal. Alright, after the wound's clean, we're going to reapply a dry dressing into it. So we're going to open up another sterile 4x4. Actually, let's go ahead and discard my gloves. I'm going to do hand hygiene again. We're going to open up another sterile 4x4. And cover the wound. Oh, actually, before all of that, I almost forgot. We have to assess the wound, make sure there's no exudates, note if there's any granulation, make sure, note if there's any redness or any swelling, any signs of infection. Check the color around the wound, on the wound. Kind of touch the skin, see if it's warm, any signs of infection, and then we cover it up. Okay. And again, it's a makeshift ABD since her legs are really small, so pretend this is an ABD. Just going to put another 4x4, put a tape on each side. Discard my gloves. Perform hand hygiene. After performing hand hygiene, you have to make sure that you write your time and date, initials on the dressing, and reposition the patient. Make sure the patient has a call light. Ask the patient if there's anything else they need, and you document your procedure. Now we're going to do a wet to damp dressing change. Same procedure as applies. This time it's going to be a damp. So again, do hand hygiene. Put some clean gloves on. And again, we're going to gently remove the tape from the skin. Note anything on the cover, see if there's any blood or any exudate on the cover. We take our gloves off, do hand hygiene, and change into clean gloves. Then you're going to remove the damp dressing. It's supposed to be damp. There you go. You're going to note any exudate on this one as well, any pus, any note on the wound if there's any granulation, any redness, any swelling, any signs of infection. Make sure you check the skin. If there's any, if it's warm. Now we're going to clean the wound. Again, pour some saline solution on a sterile 4x4. We're going to change gloves, do hand hygiene, and then we're going to clean it again. Same procedure. You grab the corners, get rid of the excess saline in there, and again we're going to do proximal to distal. And you get rid of that one. Grab another one. Grab the edges. Wring out the excess saline. Again, proximal to distal. Get rid of that. We're going to change our gloves, take it out, do hand hygiene, and put clean gloves again. Now we're going to put the damp dressing. Make sure you open the whole 4x4 up. We're going to try as much as we could, as close as possible to the size of the wound itself. And place it on top of the wound. And then we prepare our cover, our 4x4, aka the ABD. We cover it up. Make sure you mark date, time, and your initials. Remove the gloves. Make sure it's inside out. Do hand hygiene. And get rid of the rest of the supplies that are used. Place the patient in a position of comfort. Document. And ask the patient if they need anything else. And other than that, that is the video for dry to dry and wet to damp dressing change. Thank you.